All right.
Yeah.
Okay. So I'm recording now. Okay.
Yep.
Welcome everyone to the podcast or YouTube. Today we're talking to Dr. Chai, who is an immunologist and allergist with for children. We worked together for a while at a major Sydney Children's Hospital. But yeah, so I'll just over to Chai. Tell us a little bit about yourself
Yeah.
for those who don't know you.
Okay. Yeah. So, hey, I'm Chai. I'm a pediatric allergist and immunologist, as Heidi just said. I work privately, part-time. I'm in my pajamas. We're doing casual kind of just Q&A tonight kind of thing with Heidi and myself. I've got two little ones, 2 and 4 year olds, so I kind of get the toddler food, introducing allergens and just solids in general life. Yeah.
Oh, I'm just trying to see if I can change the view so that we're like equal size.
Oh,
I
not
don't know.
equal at the moment. We're equal. It's equal on my side and about your side.
Let's have a look. There we go. That looks a bit better. There we go. I look like a tiny little pinhead at the top.
Oh no.
So, okay, so we had some questions. We're going through allergies seems to be still kind of exploding. It's a really hot topic. As we know, Australia is one of, if not the highest rate of childhood allergy in the world. We still don't particularly know why. There's some theories, there's been a few studies, but yeah, so allergy is just a hot topic. And unfortunately, 1 in 10 of you listening, if not already, will likely have a baby develop a food allergy. So it's just really important to be informed because also you're very likely to have a friend or someone in the mums group or someone who you know that also has might develop a food allergy, so it's good to be in the know. Things have changed. People say, it didn't used to be like this when I was younger. Well, no, it didn't. And it is different now. So, there's just a lot to unpack with it not being an intolerance and it being an allergy and then being two completely different things and working on two different systems. So we got some questions, but I think I want to put the most common question over to you first, actually, about why is the rise in childhood allergy, do you think? What's happened and why Australia is one of the highest?
Look, that's the unknown, just like you said. I think there's no easy answer to it, isn't it? We don't know if it's diet related, environmental related. Who really knows? It's one that we don't know. They've
Mm.
looked into stuff like vitamin D, sunlight, whether moisturizers make a difference, even if you don't have eczema. We just have no idea. It's just increasing. And in Australia, we've got one of the highest rates of food allergies. So it's more how can we reduce the risk and stuff, really, because it's probably multifactorial, to be honest. I don't know
Mm.
if you have any say about it, Heidi.
No, I can't. When people ask, really, I sort of talk of the study about children being born out with their parents' country of origin. Um,
Yeah.
that was one theory, and then sometime I think there was one about children growing up in a house full of dogs, not full of dogs, but with a dog that maybe
Yeah, it
are least
reduces your
likely
risk.
to develop
Yeah.
food
Yeah.
allergy.
Yeah.
But again, I think this
Yeah.
is another thing that absolutely does a family's heads in is because we just don't know. And there's no one way
No.
to fix it. There's no like, right, there's antibiotics and that will fix your problem. It's
Yeah.
just you're kind of stuck with it. And often it's just an avoidance thing and you can't fix it necessarily. So,
Mm.
and it's a slow process as well.
And
So we've
there's,
got some
yeah.
questions. Oh, sorry, go on.
Oh no, I was going to say there's a lot about like gut microbiome and whether that makes a
Mm,
difference and stuff. And I get a lot of questions about, probiotics, prebiotics, is there a benefit? And look, we don't know the answer to that. There's studies looking at that when it comes to like oral immunotherapy and things. We don't have an answer. And I'd say my response is generally there's nothing bad about probiotics or prebiotics. So if you want to do it, go ahead and do it. It's not an unsafe option, but there's no kind of one I would suggest. I guess, as well. That's the thing that
yeah,
comes up.
thing that you'll know who I'm talking about. Our head of department used to say to all the parents, just have like try a pinhead amount of something or other. This was with a specific child, like not this isn't for you to do at home. This is for specific children. He'd say take like a little amount of whatever food and give it with this specific like probiotic yogurt kind of thing, because
Mm.
why not? You know, if it's not going to do any harm. I think that was a theory for a while.
Mm.
But yeah, no, we just don't know, which is very frustrating. Maybe one day.
Yeah.
So we've got some questions from parents, which I'm going to throw to you, Chai. And one of them is, my 8-month-old is allergic to egg. I'm terrified to introduce peanut now in case she reacts to that too. Should I wait, or is it actually more important to introduce it soon?
So we always say early introduction is really important to reduce the risk of food allergies. Look, majority of the time you're going to be allergic to just one food allergen. Yes, I do see kids who have multiple food allergies, of course, because I'm an allergy specialist, but most of the time it's going to be just one food you're allergic to. There was a study that has shown that there is a potential link between egg and peanut allergy. However, it doesn't mean it's definitely going to happen. So, what I would usually suggest before you've seen your allergy specialist is to continue to introduce other allergens at home in a safe way, because early introduction we know reduces the risk of a food allergy. Now, it's not going to stop your child from having a food allergy if it's going to happen. However, I think I would just suggest to go ahead and do it. And do it cautiously and slowly, and in a kind of safe environment where you feel comfortable doing it. Yeah.
Mm, mm. And also, just something that I explain quite a lot. It's not necessarily a question I get, but it's something I explain quite a lot because I think it's really important. I wonder if you could explain it your way. Is that how children become sensitized? So not like the internet, not the scientific kind of way, but how like breast milk on the skin, like how it works, and where how if a child is sensitized to a food, what's the most likely scenario?
Yeah, so there's two ways. Firstly, we would avoid putting food products in the skin because we know that's a way that you can get sensitized if your child has not consumed the food yet. And kind of a simple explanation is if it's introduced through the skin, importantly, more so through broken skin, like kids with eczema in particular are at risk. Your body doesn't like it being introduced in that way, so it kind of looks as foreign and produces some stuff to essentially fight this thing that it thinks is not normal. So then when you consume the food or your child is given the food for the first time, they recognize it as foreign and something that they shouldn't be consuming and have an allergic reaction. So you don't want to introduce it through the skin first, would be, I guess, a simple way of explaining it.
Mm,
Um, so you always want them to try it first orally, so feed it to them. Don't rub it on their skin, don't rub it around their lips or mouth, pop it straight in their mouth. And you can start with like just a little smear if you're worried about it, and then carry on from there and slowly introduce more, because we know that's the best way for your body to see it first.
mm,
But we don't know why then sometimes you have that, adverse, the body sees it and goes, no, I still don't like this. And then the next time you're exposed, they have the reaction. But we know that that is the best way of doing it rather than through the skin, I guess.
mm. And what do we know about breast milk? How likely is it that they're sensitized through breast milk from what their mum's eating? That comes up a lot.
Oh, yeah. Look, so we don't know. They're doing big studies into this at the moment through Perth, called Pregnarts, getting mums to eat like lots of a particular type of food, like egg or peanut while they're pregnant and then breastfeeding to see if it reduces or increases their risk of their baby developing a food allergy to these foods. However, we don't know whether it actually is beneficial or increases their risk. And so we would generally say to carry on eating your normal diet during pregnancy and while breastfeeding. If anything, there may be a benefit that your child may be getting a really tiny amount of the allergen through breast milk before they've started solids. So I wouldn't say remove it, but I wouldn't say increase it either, to eat your usual foods. Yeah.
Yeah. Okay. Excellent. Thank you. All right. So the next question is: my toddler has a confirmed peanut allergy. Do I need to see an allergist before introducing tree nuts at home, or can I just do it like I would with any new food? My first thought here is that probably should have been told that already. if you've got a confirmed peanut allergy, but not all doctors work the same. So,
Co- Correct. And so again, similar concept to what I mentioned with the egg and peanut scenario. Usually, if you've got a peanut allergy, it's probably going to be the only allergy your child has. Though we do know there is a slightly increased risk if you've got a peanut allergy that you have a tree nut allergy. However, a lot of the time that's not going to happen. And so we would say continue to introduce the other allergens, which is the tree nuts as well. Obviously, people confuse peanut to be a nut in itself. It's actually not. It's a legume, so it's more related to other legumes, and the tree nuts are completely separate. And I guess within the tree nut family as well, every nut within the tree nut umbrella is very different, except for a couple of them. So, say, for example, if you've reacted to hazelnut, just kind of digressing a little bit for the other mums or dads out there, parents, that you would just go ahead and keep introducing the other tree nuts. The only caveat to that is if you've had a reaction to cashew, that we know it's closely related to peanut, so avoid those two, and vice versa, and then walnut and pecan. But overall, you just carry on introducing them again cautiously and little by little. Yeah.
okay. So people always link the cashew and pistachio. So it's they're linking cashew and peanut now, are they?
Are they?
No, that's
I
what
don't
you
know.
just said. You said cashew and peanut.
Oh my gosh. That is my evening brain. I cannot believe I just said that. I meant
No,
cashew
because
and
see,
pistachio.
I was going down the route of because cashew is becoming a much more common allergy. So I was thinking, well, that
Oh
I
my
know that.
gosh. Oh my gosh, Heidi. No, 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 no. Cashew and pistachio are
Mhm.
linked. So if you react to one, the other one you would
Yeah,
avoid. And with pecan and walnut, same thing, they're related to each other.
yeah.
Peanut is completely separate. Yeah, cashew is like one of the more common tree nuts you can be
Mm,
allergic to. But if you've had a peanut reaction, you would still carry on introducing the tree nuts. Yeah.
yeah. So they're like botanical sisters, if you like.
Yeah.
Um, okay, so my son reacted to cow's milk at 7 months. Now at 10 months, I'm supposed to introduce other allergens, but I'm paralyzed with fear. How do I calm my anxiety enough to actually do it?
Look, I completely understand. Super worrying situation. Just navigating introducing solids in the first place can be really daunting amongst like sleep and all the other things going on in your life. I would say, unfortunately, the best way is to introduce it. Skin testing is out there, but it is a guide. You get a lot of false positive and false negative results, so we would never recommend doing that. Your kind of gold standard way is introducing it and introducing it through feeding it to your child. So, what I would start with is starting with the teeniest, tiniest amount when you're doing it. So then that way, you're more likely to have, if there were to be a reaction, a mild reaction versus severe. So the chances are lower of having a severe reaction because you're giving them less of the thing that they're allergic to if they are by chance allergic. And then kind of setting yourself up in a safe environment before you even start the allergen. So, pick a day when you've got nothing else on, you've got a support person around, you've got some antihistamine around as well, so that if they have an allergic reaction, you've got that on you as well. So pick that up from a pharmacy, just chat to the pharmacist about what would be appropriate for your child's age. And do it usually in the early hours of the morning, so that if there's a trouble, that you can get some help from your local doctor rather than
Mm,
doing it out of, work hours and things as well, I guess. Anything
yeah.
else you, Heidi?
No, yeah, I think having a son who is continually hurting himself on a weekend at the moment, it still baffles me how there's less emergency staff on around weekends. So I would still probably just recommend doing it in business hours, just because
Mm.
not, the chances of you need an emergency staff are really, really low. But I think it's probably just a good idea to always do it Monday to Friday, 9 to 5. There's just more people about. Um, And yeah, like Chai said, not just before a nap time, but so that you don't get confused with drowsiness or any symptoms, and not when they're ill either. But
Yeah.
yeah, it is really hard because it is scary, but you just kind of have to do it, unfortunately. And I'm not saying you just have to do it, but it's like there's no way around it because your child is going to get exposed to
Mm.
this food at some point, which I think makes the anxiety even worse because you're kind of forced into it through just life because your child's, you know, allergy food is everywhere. And I was trying to explain it to my son the other day. I'm like, it's literally everywhere. If you've got a peanut allergy, a milk allergy, it's in every house, every shop, every playground. Like
Mm.
it's like, yeah, it's a lot. It's a lot.
Yeah.
Um, okay, so the next question. If my baby has eczema and already has one confirmed allergy, does that mean she's more likely to be allergic to everything? Should I be introducing new foods differently?
Um, so kind of I'm going to be saying a lot of the same thing with a lot of this, but basically, I guess to start with eczema because it's a common question, just in general, if my child has eczema, does that mean they're going to have food allergies? So no is the simple answer around it, especially in those with just with not just with mild eczema, not just is the wrong word to use because eczema is a really frustrating diagnosis and it's a lot of work on families and there's no cure or easy answer around it. And it comes to a lot of moisturizers and the use of topical steroids. Another complete different topic.
Mm,
But they've had have mild eczema as a diagnosis, they're not at increased of risk of food allergies in the first place. If they've got moderate to severe eczema, yes, they're at a slightly increased risk of food allergies compared to another infant who doesn't have food allergies. However, again, it doesn't mean it's definitely going to happen. So then when it comes to if they have a food allergy already, and in the context of having eczema, yes, they might have a risk of having another food allergy just because they've already got the risk factor of having one food allergy diagnosed, but it doesn't mean it's going to happen. So they're at slightly increased risk, but again, you would just carry on trying the other allergens and as soon as you can, because we know again that reduces the risk of them developing a food allergy.
mm,
Yeah.
mm. Yeah, okay, thank you. I know it's just so common as well.
Mm.
And let's have a look. Yeah, so there's the last question really was just about the best time of day to try reintroducing a food or introducing a food. And like we've said before, you just don't do it when they're tired and sleepy. Don't do it when they're sick. Don't do it
Mhm.
if they're needing to use, inhalers or, anything. If you look at the action plan, anaphylaxis action plan, any of those symptoms of mild to moderate, if your child is already has any of them for any reason because they're sick or have a virus or whatever, just don't introduce. They can wait a day or two. Um,
Yeah.
and yeah, I suppose just to finish off, can you tell us a little bit about OIT and how, if you think this is going to be something that's really going to grow in Australia,
Yeah.
or yeah, just
Yeah.
your summary of it really.
Yeah. Look, it's been around for a really long time in places like Europe, America, Canada, and things, and we're only kind of coming around to it a little bit now. Not even all allergists within Australia are offering it still, so it is still quite niche. I am offering it with obviously the caveats around it and kind of going through it in a lot of detail before starting the program with parents. Look, firstly, I guess the most important things about oral immunotherapy for food allergies is that it is not a cure. So we don't have a cure for food allergies yet. We're wondering though, as there might be some evidence that if it's introduced earlier in those that are younger, so under the age of 1, whether or not it reduces, sorry, it doesn't reduce their risk of food allergies, but helps them grow out of it essentially. So potentially might be a cure, but again, that's not proven yet. And so there's this study, ADAPT. You may have heard of it for kids under the age of 1 with confirmed peanut allergy, and they're trying to figure that out essentially. However, we don't know the answer to that yet. We do know that what it does do is build tolerance. And so what that means is if they're on the oral immunotherapy program and they're accidentally exposed to that food allergen, for example, peanut we'll use because it's a common one, in say like satay chicken or something like that, they won't have a severe reaction. So it reduces their risk of having a severe reaction in the community. It's really important to understand with the OIT, you have to be on it regularly. So you can't just be taking it willy-nilly. You have to be on a set program, a set amount of it, and taking it potentially lifelong, either daily or, secondarily or a couple of times a week, depending on what your allergist puts you on. But at the start, it is quite a tedious process of needing to take it every day. And there's a lot of kind of restrictions around when they take it. So your child shouldn't be napping or going to childcare or school or kind of exercising for at least 1 to 2 hours after the dose.
Mm,
So it's a lot of things around it. It's not just an easy thing.
yeah.
And there's a lot of side effects with it too. Under the age of 3, quite well tolerated, but over the age of 3, they can have anaphylaxis and stuff.
Mm,
Not an uncommon scenario while they're even on their kind of regular dose they've been on for ages, having an episode of anaphylaxis to the OIT. Yeah.
yeah. And I think that's what overseas often wasn't reported. When I say reported, I mean just advertised, was the rate of reactions and anaphylaxis in the older children that were sort of
Mm,
paying to go overseas, or it was happening overseas. We heard a lot about, the success stories, but not necessarily the older kids that would just randomly have
mm,
really
mm.
nasty reactions. And then if people do go overseas to seek it, often you don't necessarily be able to pick up where you left off from there, because an allergist here might not want to continue what they've been doing overseas. So,
Mm.
and that's quite understandable. So, yeah. And what was I going to say? Um, oh yeah, I know that one of the doctors I used to work with at the hospital when we were doing the peanut patch trial.
Mm.
Um, was that he basically said that our job is to try and talk them out of it. Because if you can't be talked out of it, then you're really in, because it is a lot of work
Yeah,
for the
it's a lot.
families, for everyone, but especially the families, time off work, paying for parking, numerous
Mm.
appointments, uncomfortable appointments, skin prick testing, food challenges. It's a lot. It's a lot. And I know ADAPT wasn't, no, IT isn't necessarily a study, but it takes just as much manpower. So yeah, I think if you could be easily talked out of it, then it's not for you, because it's a big undertaking. But
Yeah, and,
yeah,
and that's the thing I always say to families. Some are offering it at the moment, and I say to them it's a lot of work, and so don't feel bad if you don't take up doing oral immunotherapy because it's not the be all end all out there. We still don't know if it makes any difference. And yes, you do hear these success stories from overseas, but is it simply that that child outgrew it? Because
yeah.
naturally, 20% of kids with a nut allergy are going to grow out of it. And, with egg and dairy and wheat, 80% are going to grow out of it. And so was that just what happened? Like,
And that, there
um,
you go again with the whole, like, we just don't know. So no
mm,
wonder allergy families feel like they're banging their head against a brick wall.
exactly.
Okay, well that's brilliant. Thank you. Where can people find you, especially if they're Sydney based?
Yeah, so
What
I
would be their way to
work
contact?
in the inner west, so I'm working Leichhardt. So my rooms are there. I work for 3 days. Yeah, really contactable through if you Google the Children's Allergy Clinic. Um, and I say I'm Chai, but my name's Chaitanya Bodapati, so Dr. Bodapati. But usually you can find me if you look up like Leichhardt Children's Allergy Clinic. And then we've got our website and you can put an inquiry through there and one of my secretary will be in touch. Yeah.
Excellent. I'll link it all with because this is going to go on you. If you're watching on YouTube, that's great, but it's also going to be in the podcast and on social media as well. So I'll link it all there. But thank you so much.
No stress at all.
We'll let you go
Okay.
to
We'll
bed
catch you
now.
later. Yeah, I know. I'm like, my kids are down. I'm gonna go watch some TV and just
I
wind
know.
down. Yeah.
We are fully obsessed with Stranger Things at the moment in this house. We're on season 5, and
Oh,
it's the
really?
highlight of my day every day.
You
I
know
don't
what?
want it to end.
I stopped watching it when it got a little bit weird, I think in season 2 or season 3, and people are like, no, push on, keep going, it gets better
So
again. I'm like,
good.
oh,
I think I
yeah.
love the retroness of it. I think I'm a little bit older than you, and I love like the retro, the 80s, the music, and oh, it's so
So
good.
you know what? It's not that retro, but it's still, I guess, retro-ish. We listen to a lot of on Spotify and things, audiobooks and stuff like that. And there's like a
Mm,
Dora the Explorer one. So firstly, I kind of like that it's Dora the Explorer because it's kind of older,
yeah.
but then also they've got these episodes about like the Wheel of Fortune as well, and they like
Oh,
do like a spin the wheel thing and stuff. I'm like,
oh no
oh,
way. Ah,
prime time thing we used to watch while
yeah.
like eating dinner or something. Yeah, when
Oh,
we
it
were
just
kids.
makes you feel warm and fuzzy, doesn't it? Anything from way back.
Yeah.
Mm. Oh.
Oh, yeah,
Oh, well,
anyway.
thank you so much. We'll let you go. And
Yeah,
yeah, we'll link all this. And if anyone has any questions for you, I'll point them in your direction. And we
perfect.
will chat again soon.
Okay.
Thanks, Chai. Bye.